Hello and welcome to Hopeful Hearts podcast. I'm Tamara Lexo, Executive Director of Hopeful Hearts Ministry, and I'm here with our founder, Shannon Carr. Hey, Shannon.
Hello, hello. Hi. I'm
And
excited to have our guest
I'm
on
so
today.
excited. We have our friend here today, guest Dr. Dawn Harrell, and she is amazing. First of all, I'll just say that she's amazing. She is my chiropractor and maybe yours. So,
Yes. She has been, yes, for sure.
and so we were going to have her here today to talk about chiropractic care, yes, but also how that relates to trauma and what happens in our body when we have gone through trauma, both physical and emotional, and what that looks like. But I'm going to start off doing something that Shannon's going to go, "What?" Because I always forget. I always forget to do a little
Oh,
disclaimer and say,
there you go.
one, if you have little ears near you, that then maybe they shouldn't be near you while you're listening to this because you never know what we're going to say or what we're going to talk about. And it might be something that you are not ready for your little ones to hear or understand or talk about. So save this for a time, whether you're watching it or listening to us. Save it for a time when little ones are not around. So I have had back problems for several years now, back in like hip. I first really started noticing it when my daughter, who is in grad school now, when we were touring campuses and I was walking with her on these campuses and I felt this grinding in my hip. And it was like those memes that I say when I feel like Barbie, what I mean is my hip clicks when I walk. And that's what I felt like. It was like this grinding and this clicking. And one would think that I would call the doctor and be like, there's something wrong here, but I didn't for a few years. And then my lower back started hurting and it got to the point where I couldn't stand for very long. Um, and I would see Dr. Dawn at networking events,
Mhm.
mostly like Kingwood business women. And she was like, "You look like you're in pain. Why don't you come see me?" And I was like, okay. And this went on for like 4 years. Now,
Yeah.
why did I wait that long? I don't
Right.
know. I don't know. And that's probably a topic for another day on why we don't
Mhm.
take care of ourselves. But Shannon, you had back surgery. Was that last year?
I had in 2024, I had back
Oh my
surgery.
God.
In 2008, I had back surgery. So I've had back surgery
Oh, so you've had
twice.
it twice.
Uh-huh. Yeah.
Ouch.
Yeah.
Okay, so
And and I had recently gone to Dawn, and I have to say this just to kind of toot her horn a little bit before she ever speaks, but she's very comprehensive in everything that she
oh yeah.
does. And I I had already had back surgery. This was last year. It was a year after.
Mhm.
And I was having constant pain in like my butt area and like all this.
Mhm.
And so she does the x-rays, she looks at all aspects. And I was also, though, dealing with female stuff. I still
Mhm.
had something going on. We weren't sure what the heck was wrong with me. And what I love is when a doctor doesn't want to just be like, no, I know that, like, if as long as you just do this, you're going to be fine. Like, she was very much like, you need to look at everything.
Yeah.
You need to look at it all. And I appreciate that, Dawn. And my that one back stuff actually ended up from being all this endometriosis that was bundled up in my system, which was, and then the pain went away after I got it removed, crazily. But
Which is
um,
amazing.
yeah, I mean, what I know when we talked about chiropractic, so I want Dawn to
Mhm.
speak. She started probably listening to
Yeah.
us go, shut up so I could
Shut
talk.
up, you guys.
Um, I see
Why
her
did you
little
have
sign in
me
her
here?
background that says "Be nice or leave." Thank
Yeah.
you. And we're
Yes.
not being nice because we're not letting her speak. But I want to say something real, my own disclaimer for Dawn, because she's the chiropractor here, so she obviously knows what she's doing. But I know some
Mm-hmm.
people are so scared to do it because you're dealing with your spine. And I bet money, and Don could probably speak. If I had gone years before my first surgery in 2008, I probably would have never needed that surgery because I would not have perforated through, my
Right. Right.
whatever it's called, perforated through the little thing, squishy thing. What's it called,
Vertebral
Don?
disc. Vertebral
Yeah,
disc.
yeah,
Yeah.
that thing. You're not see if you're not watching the YouTube, I am
Yeah.
making
She's making hand
hand puppet
motions.
motions. But am I not
Yeah.
wrong, Don? Had I just gone to a freaking chiropractor and not been so scared to go, I probably would have not had to go through
It,
all that.
it's definitely a great first step, right?
Yeah.
You're looking, if that is an inevitability, then it's an inevitability. But if there's anything we can do to see where your function is, where your spine is in your degeneration phase, then yeah, I think chiropractic can absolutely keep those things at bay as long as possible.
Hmm. Yeah.
Well, and that's why I went to see her. So I had gone to my doctor first, who sent me to a spinal doctor, and the spine doctor was like immediately examined me and he goes, "Well, I can see that you hold all your trauma in your hips and your lower
Mm.
back." And I was like, "Oh, how can you see that?" And he was like, "Well, it's just the way you hold your body and the way you twist when you move that." And so, that really got me thinking, and then I did MRIs and all that kind of stuff. And they were like, "Well, we think you need to do surgery." And I just wasn't ready for that step yet.
Yeah.
And so I finally did go see Dawn, and she's been amazing. The results that I've had in only 4 weeks have been phenomenal as
Yeah.
far as dealing with pain. So, Dawn, talk to us about one, like how that works and just like what you do. And when a doctor says, "Oh, you hold your trauma here," like what is that? What does that mean?
Well, okay, so the trauma response, especially, I think I should probably give one of my own disclaimers. Like, remember, I
Yeah,
am a board certified chiropractor, but nothing I say is actual medical advice today.
right, right.
Nothing
You're
substitutes an
just giving your
actual
opinion.
exam.
You
So,
cannot
Hmm.
sue me or Tamara or Dr.
Or
Dawn
Dawn.
if you
No,
right,
go and,
do
choose to
right,
make a decision just because you
right,
listen to
right.
this podcast today.
right.
Um,
That would be
um,
It's a
silly.
hold harmless clause.
right, yes, like, hey, just so you know, um,
Right.
when we talk about trauma,
Yeah.
when I was an athletic trainer, I actually worked on my
Mhm.
doctorate of athletic training. So I actually have the highest level of degree you can have for athletic training. I have the highest level
Mm.
of degree you can have for chiropractic.
Of course you do.
Right. Because why not?
Yes.
Nothing wasn't even like there's so many years in between each one of the degrees.
Right.
But when I was working on my doctorate degree, I got kind of into a doctor, a author and a doctor named John Sarno, Dr. John
Hmm.
Sarno, and he talks a great deal about the psychosomatic pain.
Mm.
Okay.
And what really got me was listening to him talk about women who were postpartum who had back pain.
Hmm.
But if they looked at any imaging, x-rays, MRIs, CAT scans, evaluations, the women that he was talking about in the study, none of them had markers of damage on their spine,
Oh.
but they had
Hmm.
back pain because pain is
Hmm.
absolutely real.
Yeah.
The problem wasn't necessarily the physical structural pain or structural issues. It was that being a postpartum mom is really freaking hard.
Yeah.
And these women, to a person, were basically like, no, it's the greatest experience of my life. It's the greatest
Mm.
experience of my life because people told them that it should be.
Mm.
And they were recognizing that it's hard and, sleep deprivation, babies, problems, all of the things that I actually see on a basis
Mm-hmm.
These moms are actually repressing that acknowledgement of the hard and of the suck that is that postpartum time when everything can kill your kid. And
Yes.
your husband probably being a good man, but he's got to go to work and he's not there. And if you don't have a support system, but basically the short of it is these women were not acknowledging the trauma and the actual like psychological problems that were going
Mm-hmm.
on, so it was manifesting somewhere else, and it was manifesting in their lower back pain or tusa pain. And
Mm-hmm.
that really got me to really worry about like what are we doing as a society, especially with our postpartum moms,
Mm-hmm.
because when you hear a mom who has just had a baby, how's the baby? How's the
Mm.
baby? When you're pregnant,
Mm-hmm.
how are you doing? You're doing so great. Oh my God, you look so
Mm-hmm.
wonderful. Baby, how's the baby?
Yeah.
No one talks about
Yeah.
the mom, not even the doctors. So I say all that to bring up that when we hold on to trauma, especially psychological, our bodies need to deal with it. And so the body's going to deal with it in some way. And sometimes it manifests as something that can't be clinically diagnosed.
Okay.
So you end up with this manifestation of hip pain, back pain, because society understands those pains. Like, oh, you have back pain. I have a bad back too. I
Mm-hmm.
totally get it.
Right.
And so that is one of the major things I look for, especially in my postpartum moms,
Mm-hmm.
is what I'm like, you always have a safe place to come in and tell me it's really hard. And
Mhm.
Yeah.
I'm not going to judge you. I'm not going to feel any other way towards you other than we got to get you feeling better in your back. So if it takes you telling me that you just want to like fall down on the ground and cry, that's okay. We can talk about that.
Mm-hmm.
And if you need to, I've got a room over here. You can go scream, cry,
Ball.
whatever you need. Like
Yeah.
you can have your time. And this is a no judgment zone. And
Mhm.
likewise for
That's
men,
amazing.
and thank you. And likewise for men, if you're a guy that has a job that kind of sucks and you've got family responsibilities and you've just got feel the weight of the world, but you're supposed to be the man, right? And you're supposed to like take care of this, and that's not supposed to bother you, but it kind of does because life is hard.
Mm-hmm.
It can manifest in pain as well because anything that's a repressed psychological emotions probably going to come out as a physical concern or issue.
Mm.
Wow.
But
Wow.
Dawn, do you think that postpartum, I love that, but now, and maybe it's because I'm in that
Yep.
phase of the whole menopause,
Yep.
post-menopause,
Mm-hmm.
perimenopause, all the things. Do you not think that it's almost the similar
Absolutely.
situation? Yeah.
Absolutely. Yes. The short, very short answer is absolutely.
Yeah.
Because I'm in that world too.
Hmm.
We're definitely in a world where the perimenopause, we're only just now starting to talk about it. Our moms and our grandmas didn't talk about it.
Mm-hmm.
Hell, our
Hmm.
grandmas ended up in asylums, right? When they
Right.
had hysteria,
Yeah.
Hmm.
because no one knew how to handle it. And you were supposed to just smile and be okay with it. I have a friend whose mom said, well, we don't do sick. Well,
Hmm.
yeah, we
Yeah.
do. We really
Right.
do. We need to do sick. We have to
Hmm.
understand that
Yeah.
our body's trying to tell us something. So in the perimenopause, we also have the actual physical nature of
Very.
perimenopause.
It is a tongue twister.
We're
Perimenopause.
tongue ties, right? Because we can't talk, we can't think.
Right.
Our ears are itching, right, Tamara?
Our ears are
Oh my
itching.
gosh,
All the time.
yes.
So,
Ah,
like,
yeah.
ladies, if you didn't know, perimenopause, one of the symptoms is like itching ears. It's a totally
Yes.
natural, I don't want to say normal. It's not normal, but it is a thing that
Nothing normal about perimenopause,
nothing.
but that is a thing, the itching ears. We talk about it
But
all
you,
the time.
yes, but you talk about the lack of estrogen that is happening
Mhm.
in our bodies, and estrogen's job is to lubricate joints. You know,
Yeah.
it's supposed to
Mm.
lubricate everything, right? It makes,
Yeah.
a fun time with our husbands better.
Mm-hmm.
And if you don't have the estrogen and you're lacking that lubrication, what are your joints going to do? They're going to stove
Mm.
up. So I
Mhm.
see a great deal of women my age, in that 45 to 50-year-old range, with what they're thinking is frozen shoulder.
Mhm.
Oh.
Like, oh, I can't lift my arm above here.
Ah, yeah.
And what I've found is not only is it not frozen shoulder, there's a muscle that's kind of right here in that armpit that we definitely need
Uh,
to release and make sure that it's moving well. But those adhesions develop because you've got the lack of estrogen and just the hormones that are out of balance, that the joints aren't getting the health that they actually need.
Oh, very
Fascinating.
interesting.
Yeah.
Yeah,
That is
very
fascinating. So
interesting.
I have to say, the first time I went to see Dr. Dawn, and she was kind of giving me a questionnaire, and she was asking me, like, how often does your neck hurt? Like, how often do you feel tension in your neck? And I was like, just the normal amount. And she started laughing. She was like, okay, that should be zero of it. Like,
Yeah.
there's no
The normal
normal.
amount is zero. I
The
had this.
normal amount is zero. And I'm like, oh, because like if I'm stressed, if I'm worried, I get so tense in my shoulders and my neck, and it goes up into headaches. And, it's like
Mhm.
I feel it coming on because I'm stressed, or, my lower back. Like I start worrying, and I don't know if I'm moving a certain way when I'm worried, but then my lower back is like, oh, it's out. I mean, it's a thing that people feel, like stress,
Mhm.
pain, when
Yes.
they're overthinking, overworking, over stressed.
I don't
Mhm.
want to give a lot of like or too much attention to cortisol because I think
Yeah.
that we're
Mm.
seeing that way too
Over.
much. I'm
Yeah.
over
Mm-hmm.
cortisol. Cortisol is a thing,
Yeah.
absolutely. The only way to reduce cortisol in your body is to reduce your stress, everyone.
Yeah.
Any of these Instagrams or Facebooks are like, oh, lower your cortisol by doing this diet or XYZ medications.
Mm-hmm.
Don't. Don't even like they're it's a
Yeah.
waste of money. But so it is lowering stress. So because it's a stress hormone, and if it is another hormone that's released in your body, it's going to throw off the balance of all the other hormones. And that's where you start getting calcium's not absorbed by the muscles correctly in a way that gives them the proper muscle contraction. And so you end up with these like spasms because there's just too much calcium put
Mm-hmm.
into it, and you're not getting the signal to release. So not only is it neurological, but it is hormone driven, especially when we talk about those high stress states.
Mm.
So it seems like what I hear you saying, and correct me if I'm wrong here, if you have a lot of stress in your life, if you're overthinking your past, your present, your future, that maybe you should talk it out,
Mm-hmm.
get the rest you need, drink plenty of water, and stretch your body, move your body.
Move your body. Yes,
Yeah.
absolutely.
So, not get online and go shopping, because that's kind of my preferred manner.
I mean, I can't tell anyone not to do that, but you got to
That's
add
my
it to the other
preferred
stuff you just
method.
mentioned.
That is
Or
funny.
Chardonnay, or
Again, I can't not say that.
right. I know
But
you're not
no,
giving medical advice today.
right, that's right. But yeah, your key was absolutely the talk it out. You can't do better than that. You need to talk to someone if you are that
Yeah.
person who is just in that high stress period of life and
Mm-hmm.
you feel like you're on the edge. Talk to
Mm-hmm.
someone, please, and
Mhm.
then move your body. And then that person should definitely be advising you to get up and move
Yeah.
because
Mhm.
movement gets the blood flowing. Feed your brain. You feed your brain. You can come up with, if it's a solution that you're looking for, you've got blood going onto your brain. So getting up and moving is
Mhm.
always going to be my primary number one go-to advice for everyone.
I want to make a comment, and I think Tamara may relate to this in some way. Back in the day, so 2008, I'm trying to think of how old I was then. I guess still my 30s, maybe. I don't know how, I can't do my math, but I remember before having that major back pain, and then ultimately ended up going drop foot, which means that like
Mm.
I had no use, like, or that nerve was
Yep.
so affected. But I specifically remember being in my 20s and hearing people talk about back pain and being like, "Ugh, whatever, like
Oh,
they won't be quiet. They're just complaining. How could your back hurt that much? One minute you're, walking fine, the next minute you're t saying that your back's in pain." And I used to be that horrible young person that was like, "Oh, whatever, quit complaining," until I had
Right.
back pain, until I had to where it just kept, like I said, kept getting worse and worse and worse. And I mean, Tamara, you could say if you feel that way or not, but I feel
I
like some
do.
people that have never had back pain, they don't get it,
Right.
right? And I don't know. I just wanted to speak that out loud because I think if you are listening to this and this is not something that maybe trauma isn't affecting you in this way in your back, or it's not giving you certain aspects. Great. I'm glad. I am so
Yes.
Right.
glad. But please don't, again, try not to make someone else feel bad
Hmm.
because they have back pain,
Right.
and maybe
Yeah.
encourage them. But Dr. Dawn, I should say,
Thank
should
you.
be, sorry. What are some other things besides just the back pain? Because you were talking about, releasing the
Hmm.
muscle here a certain way for, your shoulder issues. What are some other things that you maybe take care of? And I mean, it's not just,
No.
right? It's not just the spine.
No, it's definitely not. And that's where
Mhm.
I get to lean on my athletic training background a great deal is through like the different joints. I still love today treating an ankle. Nothing makes me happier if I've got, especially a young kid, but anyone who's sprained their ankle to come in. There are some techniques that I'm not the only one in the Houston area who does it. I'm one of the few, and I'm definitely the
Okay.
only one who has a doctorate in the technique,
Oh.
who loves, and I love treating ankle sprains because there's a couple different ways to look at how an ankle sprain occurs that most physicians don't look at how it happened and how to manage that. So I love treating ankles, knees, shoulders, you name a joint, and
Head,
Hmm.
shoulders, knees, and toes.
heads, no, all of it. I love working with the human body and trying to
Hmm.
understand how it's supposed to work, what is the actual normal movement, and what someone has come in and said, well, it's just normal for me. That is not, it's a malnormal. And being
Hmm.
able to be the person who can affect that joint or that
Hmm.
issue in a positive way. But I do love taking care of ankles, even smelly feet. I'm just like, yeah,
Hmm.
give them to me. I'll take them all day long.
I think
That's so
that's great. I mean, your
interesting.
ankles are so important. I mean, gosh, I just think like if, you wouldn't be able to walk if
Right.
if your ankle's not working, or if
It's,
You
it's
know,
weak or
yeah,
yeah,
it's the
my
first thing that
husband
touches the
broke
ground.
both of his ankles in
Ooh.
high school, and he has arthritis there. He should probably be coming to see you. When he tries to sneak up on me, he can't because when he walks, it goes click, click,
Click, click,
click,
click.
click, click.
Well, I like to tell the story about my mom when it was in 2013, she developed this ankle pain walking down the stairs to go to the laundry room or go into their
Mhm.
basement. They live in Idaho, so they actually get basements. And she couldn't do it. She could not push off of her foot working out, all the things. She went to orthopedist and they took an x-ray. They said, man, this doesn't look right. It looks like some arthritis here. So they did an MRI. Yeah, we found arthritis in this MRI. We're going to do surgery. We're going to go in. We're going to clean up all this stuff. And she had the surgery. In 2014 is when I began my doctor of athletic training. The second day, they showed us a technique that helps get that, like, it's called plantar flexion, where you point your toe to get that motion back using a couple straps and just kind of using the body's natural motion. And so I'm like, oh, let me try this. So I went home. I had no fancy belt. I literally had my dad's leather belt I put around my mom's ankle in this manner. And I pushed the kind of the top of the ankle back and pulled the front of her foot to kind of get this motion. We did 10 repetitions and her pain went away.
Mm.
Wow.
After surgery, never cleared up. After MRIs, all the doctors, all the medicine,
Mm-hmm.
everything, nothing fixed it. We did 10 repetitions. She's not had that pain since.
Wow.
Not crazy.
Sold.
That's amazing.
Absolutely sold. And that is what really started my journey in manual therapy that
Mm.
has led me to realizing that I can be a really good chiropractor and use my hands to make people better in situations where surgery was her only option.
Yeah.
Right.
I love that. I love that. It's something that Shannon and I deal with a lot with people that we work with and we talk to and tend to, I feel like, I don't know, I don't want to overgeneralize this, but when someone has been through an extremely traumatic or abusive situation where they were living that lifestyle for a long time, and it doesn't even have to be that. There's just some people that have a mindset of I don't deserve to feel better, or this is just how it is now, and this is what I'm gonna have to deal with for life because I'm aging, it's well, a woman
Mm-hmm.
of your age or a person of your age,
Yeah.
or like this is just my lot in life,
Mm-hmm.
the Eeyore
Oh yeah.
mentality, and to go, no, there's hope out there. I
Mhm.
mean, you may not feel like you're 16 again, but you may be able to walk up and down your stairs without creaking, you know.
Right.
You may I may be able, like I told her, I said, I walked through the store the other day and I had no pain. Like
Mm.
a few weeks ago, that was not possible. So, there is hope there. And it's like I want to tell people that that's possible.
I love that. I absolutely love that. Uh, that is one of the other reasons I like that we take x-rays,
Yes.
because what we can see on x-ray is what we hear from patients is, well, I'm just old. The doctor told me I'm getting old and that's a
Yeah.
natural thing. What I love is looking at an x-ray and going, huh, well, isn't that bone and that bone the same age as that bone?
Wow.
So if
Yeah.
that bone and that bone, those look good, and this one
Mm.
doesn't look good, but they're the same
Mm-hmm.
age, probably not from age. It's probably from some other system that's happened, an injury
Mm-hmm.
or some outside force that's been acted on that bone. So
Right.
that I don't take well, it's just because I'm old. Well,
Yeah.
probably not.
Probably not.
Probably
Yeah.
not. And there's definitely things we can do uh, here, especially at Bear Paw now that we've brought on a nurse practitioner in the last 6 months, that extends our reach into the medical and the chiropractic realm.
So tell us more about that. Like what you're doing to help heal bodies with
We
stem
have
cells
moved
you're
into
doing.
the space of using regenerative medicine.
Mm-hmm.
Now, I have to be a little careful on how we word this, because
Yes.
although the FDA has approved uh, most of our treatments for use, but
Mm-hmm.
they've approved it for use in aesthetics.
Okay.
So we have to be, I'm a little more,
Interesting.
so I use the term regenerative medicine as a very
Mm-hmm.
broad term.
Okay.
But
Mm-hmm.
basically, what it is we're able to do injections
Mm-hmm.
into specific joint spaces and around the spine, around the knee, around the shoulder to help the body use its own methods of healing naturally. So it's just kind of a little boost to the body that
Mm-hmm.
gets the body to, but ooh, I need that. I'm going to use that and I'm going to heal this joint because the body wants
Uh-huh.
to move and it wants to be healthy and it's going to do whatever it can.
Yeah.
Sometimes it's just a really bad general contractor and
Uh-huh.
it kind of settles when it settles the bone down, it settles it in just all over.
Yeah.
So we can use platelet-rich plasma is one of our really great ones where we actually draw the patient's blood. And by we, I mean not me, my nurse
You're
practitioner
right.
is.
Right.
We draw the patient's blood and we're able to centrifuge it down to just the platelets. And the platelets are the chemicals. Well, when you see a scab, you're
Mm.
seeing a platelet, like a bunch of platelets all mixed together. That's on the outside. On the inside, what it's doing is it's bringing on the healing cascade. It's bringing on the inflammation chemicals to say, here's where the injury is and you need to fix it. So on the inside, it's
Oh,
starting to heal itself. That's why we don't bleed out, because the body is able to stop that bleeding in the blood vessels.
right.
And so we're able to centrifuge the blood down to just the platelets and with a specific chemical mix that in and then re-inject into the patient. So for your chronic pain patients,
Mm-hmm.
the arthritis patients, anyone with a herniated disc, ooh, we love those
Mm-hmm.
because we're able to direct that healing to this spot and the body
Mm.
says, oh, I totally forgot that was an issue.
Yeah. Right.
Okay, I'll direct my
Mm-hmm.
and brings the body's healing factors into that area and it really can do a great job on healing herniated discs and joints. And
Wow.
so we've got some other chemicals that we're able to use that can actually be injected into the joints, which bring in new cells for the body to be able to use.
Awesome.
I just find all of this fascinating. Shannon and I talk a lot about brain science here and how our brain is wired to protect us during emotional, traumatic, abusive events, but how also our brain lies to us sometimes, like we do, because the brain doesn't know the difference between the truth and a lie. And so, whatever we speak, it's going to believe. And here you're injecting these cells in there so the brain goes, oh yeah, that's where I need to that's where I need to send help there. That's what I need to
Hmm.
do. I love it. I
Yeah.
I find this so fascinating,
Well,
especially for people like you said with chronic pain, because chronic pain is more than just it's more than just wearing on your body. It does
right.
wear on your heart and your soul and your mind after time. We see so many people that fall into deep
Deep.
depression
Yeah.
because of chronic pain.
Yeah. I've had multiple patients sit on my table and just say, I want to feel normal again.
Mm-hmm.
Mm.
And, I've been very fortunate that their relationship with me, my abilities, and their bodies have responded very, very well to that.
Mm-hmm.
Patients who are not able to sit and go to church
Yeah.
are now going to church twice a week.
Right.
And
I love that.
if that is part of your community and your mental health thing, that church or the family
Yeah.
gathering or whatever it is, where you were avoiding it for a long time,
Mm-hmm.
being able to find that pain, because that's the other part with chronic pain we overlook a lot is in our brains we have uh, this space, and that space recognizes where that pain's coming from. If you bump your knee on your desk, your brain's like, oh, that was my knee.
Mm-hmm.
But if you are in a chronic stress, trauma
Mm-hmm.
situation, chronic pain situation, your brain has it's receiving so much stimulation from so many locations that it's not able to actually locate where it is. So it's like,
Mm.
oh, well, maybe it's my toe or maybe it's my back
Oh
or
well.
whatever. It's getting information from so much. So it just kind of grabs onto a
Mm-hmm.
spot and holds onto that. And we see that a lot in our chronic pain, but our trauma patients as well, because they
Mm-hmm.
don't know where that pain's coming from.
Mm-hmm.
So being able to use the muscle work that we do and how chiropractors are able to work is we help the body calm down the crap signal. And by
Yeah.
calming down that crap signal, the brain can find where the problem
Mm.
is. That's why the muscle work, the active release technique that I do is so
Mm.
beneficial because it finds a tender spot. It kind of
Yeah.
sucks,
It
but
Mhm.
you
does. She
find
does that and
it
it
really
hurts.
does. If you want to kind of pee, throw up, and cuss all at the same time.
Right.
But you find it and you stretch that muscle, and the brain's like, oh, there you are. And
Mhm.
so
Yeah.
the brain can send a bigger signal out to reduce that muscle spasm. So um, that is one of the wildly successful things that chiropractic can do, is because it helps bring that brain center to an actual location rather than signals all over.
Mm.
It's like this
Um,
magic touch that she has where she presses and it hurts so bad. And she's like, I know it hurts. I know it hurts. And then all of a sudden it just melts like butter. And you go, oh, it doesn't hurt anymore. It's like the release of that.
that's nice. What do you do if someone feels like they want to come or they know they want to try it? However, they have been traumatized so much that they are afraid to be touched a certain way, or, I'm sure that you may have dealt with that a little bit, because sometimes you have to be hands-on,
Mm-hmm.
what would you speak into that?
Well, my biggest thing, okay, we're still good, right?
Yeah.
Yep,
It didn't
we
freeze.
got you there.
Okay. I am, I talk to my patients through the whole process.
Hmm.
That's the biggest thing. And I always let them know, especially if something's come up in the history, that
Hmm.
I will only do what you're comfortable with. Okay. There is some feel that I need to have, but I will only do what you're comfortable with. And you have absolute autonomy and the ability to tell me, I don't want that.
Hmm.
If that is something
Yeah.
you don't want, if it's not going to be comfortable, then we will move on, because there's a ton of other things I can do. I do not have to do a manual manipulation with my hands on a patient. I've got a machine called an arthrostim that's more of a vibration. Little, like if you picture a woodpecker and a jackhammer had a baby,
Hmm.
that's exactly
Yeah.
what this guy would look like. But we can use that on the body. I also have another one called an activator that it's like a single punch that can deliver an adjustment in one spot, very specific, without a lot of force behind it, so
Hmm.
that uh, really you can do a lot of great things and still get the benefit of the manipulation without that broad touching that
Hmm.
I could imagine somebody who has been through that would feel more comfortable with.
Hmm. Yeah.
It's
I
good
mean,
to
because
know.
I'll admit, years ago, before you were ever even here in Kingwood, I went to another chiropractor. It was a male, a gentleman, great person. But I did, for some reason, it was just like I couldn't get past a mental aspect of
Hmm.
it, just
Yeah.
because I felt manhandled a little bit.
Yeah.
Hmm.
And I will tell you, my husband and I have this conversation a lot. There's a past for him as well.
Mhm.
Hmm.
And when I was in chiropractic college, he was able to come down and be treated for free by the students at the school.
Hmm.
And more than once he came home, and if he had a male attendee or a male intern, he was not comfortable. He
Yeah.
didn't feel comfortable having a guy touch him, just because they always try a little harder. They're a little more rough than
Hmm.
another man. But he's like, he's just always
Mhm.
felt more comfortable with a woman. So I think that also plays into my favor, is as a
Hmm.
woman, although I'm a strong woman, and more than once I've been told intimidating. I don't mean to be. uh, but I really do care, and I have that feminine side where I can be like, you know what, cool. We're gonna only do
Hmm.
what's comfortable for you today.
Yeah,
Yeah.
very good. I wouldn't say, I mean, I could see how if somebody's insecure about themselves might find you intimidating. I find you assertive and and well knowledgeable, right? Sometimes when people know what they're doing and so they're well spoken and
Mm-hmm.
assertive, then sometimes that could come off, I just wanted to put that
Okay.
out there
Thank you. I
because
Yeah.
appreciate that.
yeah.
I might going back
Right.
to what Tamara said earlier, the brain hears, right? So I'm like,
Yeah.
oh,
Right?
yeah,
Right.
we got
The
to
brain
remember
hears what
that.
it
We're
wants to
not
hear.
that.
And yeah,
Yeah.
no, not that at all. I do have to say, I find you, I saw a chiropractor in high school. Had a car wreck and just for a brief period of time. And there was a lot of like reaching around and squeezing and like lifting me off the ground to
Hmm.
pop and do things. And I I can say that you've never done that. Like you always make me feel so comfortable in
Good.
what you're doing. She even has these amazing pillows for if you have larger breasts. So when you lay down on the table, it's not like smash,
Right.
smash.
And for my, I have a patient who is recovering from breast cancer,
Yeah.
Mm.
breast
And so you,
mastectomy, and then
mm-hmm,
her new breast.
right.
And she's like, no, I need those. Put those on so
Yeah.
that she's not getting that compression on there. Uh,
Yeah. She calls them tillos, but I couldn't remember that for the first few weeks. I kept calling them titulas. And
I
the
wouldn't know. I would
pillows.
never have to use that. So
yeah.
I don't
I was like, get out the titulus. I'm like,
I
wait,
need
that's
them.
not the word.
I need those pillows.
Telos.
know. Oh
Well,
my
Dr.
goodness.
Dawn, thank you so much for being here with us today.
Thank
I just
you.
want to tell everybody, well, I'll let you tell everybody where they can find you.
We are
Mhm.
on Instagram. We are on Facebook. If you look up Bear Paw Medical on both of those. But really, the best way is just give us a call or send us a text if you want more information from us. Our phone number is 281-852-8724. You can call or text that number. Like, that's the best way to get a hold of us. I do have a remote assistant who will answer as much as she can. And then if she can't, what
Yep.
she says is, let me ask Dr. Dawn, and we will get an answer for all of our patients.
So
Yes. Well,
that's
we,
Bear Paw, Bear, by the
Yes.
way,
mm-hmm.
not Bare.
No.
Bear,
But Bear
like
Paw,
the,
yeah, like
bear paw.
Burr.
Yeah.
and Don, that Dr. Don, that number again was 281-852
8724.
8724.
Yep.
Okay.
And then our
Thank you
website,
so much.
oh, thank you. I was going to say
No,
on our
yeah.
website, we
Give me your
actually
website.
have a chronic pain like questionnaire if you're kind of just want some
Oh,
more
good.
information where you can come on and like
Yeah.
tell me more about you so that I know how
Mm-hmm.
I can direct your care. So that's
Awesome.
That's
bearpawmedical.com.
awesome. That is awesome. Thank you for being here. If you have more questions about Bear Paw Medical, you can go to their website, go visit her Instagram or Facebook. She's got all kinds of helpful stuff on those social media places. If you'd like to learn more about Hopeful Hearts Ministry, you can visit us at hopefulheartsministry.org, or you can find us on Facebook or Instagram at Hopeful Hearts Ministry. If you're watching us on YouTube, then you know where to find us there. But search Hopeful Hearts Ministry on your YouTube. We're at Hopeful Hearts 333,
Ministry. Oh,
something like
yes.
I
Yeah.
think.
Hopeful
Yeah,
Hearts
I forget.
333.
Yeah.
Mm-hmm.
And just reach out because we want to learn more about you and how we can be there for you and help all survivors become thrivers. So thank you, ladies, for being a part of this today.
Thank you for
Thank you,
having me. I
Dawn.
really appreciate it, ladies.
Yes, and we
Absolutely.
will see everyone later.
Right. Bye, y'all.
Bye.